Now I'm going to talk about the bones of the lower leg, okay? And the two bones that make up the lower leg, which would extend from the knee down to the ankle. It's going to be the tibia and the fibula. Lots of students will say tibula and fibia. So the way that I remember it is you tell a little fib, right? You tell a little fib. So the smallest or the most slender of the two bones, okay, the little bone, this is the fibula. So it's the little bone and it has the L in it. So you tell a little fib. So smallest, it's much more, it's little, okay, and it has the L in it. So this is the fibula. This is the lateral bone, okay, and this is this larger one. If you look at the proximal region of this bone, it kind of looks like a T. This is the tibia, and this is the medial bone of the lower leg. So fibula is the lateral bone of the lower leg. Tibia is the medial bone of the lower leg. So let's talk about some of the structures of the tibia first. Okay, up here, this T-shaped region, this is going to be the proximal end of the bone. Down here, this is the distal end of the bone, which would articulate with the tarsals of the ankle that make up the ankle. So let's talk about this region, the proximal end of the tibia. You see that there's these little divots, little carved out areas. Okay, these little concave areas. These are the condyles of the head of the tibia. Okay, these are going to articulate with the condyles of the distal end of the femur. So it makes sense if you remember what the condyles look like on the femur, that they would be able to sit in here, and then we'd have the able to flex at the knee. Okay, flex and extend at the knee. So the condyles of the femur would fit right in these condyles of the tibia. To be able to tell which one is medial, which one is lateral, let's go ahead and orient ourselves with what is anterior, what's posterior, and what is what's right or left in the tibia. So if you see this right here, if you see this little knobby, this is the tibial tuberosity. And the tibial tuberosity is the attachment site for the patellar ligament. The patellar ligament. If you see this tibial tuberosity, this is the anterior side of the bone. If I flip this over, right, this is more concave, no tibial tuberosity. This is the posterior side of the bone. Okay, so here's the posterior. This is the anterior because I see the tibial tuberosity. And down here at the distal end, this projection is called the medial malleolus. Medial malleolus. If you go ahead and if you feel your ankle, the little knobby that you feel on the inside of your ankle, that's what you're feeling, is the medial malleolus. So this would be the right tibia. Over here, tibial tuberosity, this is the anterior side of the bone. Here's our medial malleolus, which has to be on the inside of the ankle, so this is the left tibia. Okay? All right, so this is, let me go ahead, I'll pick up the right tibia again. So if this is the medial malleolus, then this has to be the medial condyle, and this has to be the lateral condyle. Okay, so if it's in line with the medial malleolus, well, the medial malleolus is termed that because it's on the medial side of the leg. Medial malleolus, medial condyle, lateral condyle, tibial tuberosity. Let's see, and then this region that kind of sticks up on the diaphysis, this is called the anterior crest of the tibia. All right. Okay. Let's go ahead and talk about the fibula now. The fibula, there's not a whole lot that you have to be able to tell me about the fibula. If you look, you'll notice that one end has this concave region. I'll turn it to the side, it's a little bit easier to see. Okay, one end has this concave area, and the other end has this convex area. This is the lateral malleolus. So this is going to be the distal end of the fibula. If you go ahead and feel your ankle on the lateral side, the outside of your ankle, and you feel that knobby, that is from the lateral malleolus projecting this way, projecting out, okay? So this is if you see the lateral malleolus, this is the distal end of the fibula, which is going to articulate with the tarsals of the ankle, and this concave region is going to be the proximal end of the fibula, okay? And the proximal end of the fibula does not articulate with the femur at all, okay? This is a very slender bone. It is not able to support any weight of the body, and it doesn't, okay? So this proximal region of the fibula actually fits a little bit under, okay, the lateral condyle of the tibia. So the proximal end of the fibula does not articulate with the femur at all. It only articulates with the inferior surface of the lateral condyle of the tibia. Because it's so slender, if it articulated with the knee or at the knee joint with the femur, it would have to bear weight of the body. And this is obviously not a very good bone to bear any weight. All right. To be able to tell, so head is the concave region, which is going to articulate with the inferior surface, the lateral condyle of the tibia, and this convex surface is the lateral malleolus, which would be the distal end. And looking at the lateral malleolus and which way it projects is going to tell you whether it's right or left. So look, this one, the lateral malleolus, projects to the right. This is the right. This lateral malleolus projects to the left. This is the left. Okay. And that's it for the bones of the lower leg.